Morning, guys. Dr. Joe Borio. I'm over here in central New York. It's a rainy day, right? I always feel like a weather guy when I start talking. Weather's so important to us in central New York, isn't it? So, hi, central New York. I wanted to spend a couple of minutes with you on a more serious topic today, and that's on medications and different drugs. And when I use that terminology, I'm talking about the prescription drugs, and I'm talking about the over-counter drugs, and I'm talking about the use of them in our daily lives in treating sickness, disease, and symptoms. They've become such a main staple in the life of us in America. In fact, if you go in almost every household in America and you go in their bathroom and above the sink, there's a medicine cabinet, right? We call that. So there's medicine and drugs in there. If we go to your kitchen, usually the left side, don't freak out, I wasn't in your house here, but the left side of your kitchen cabinet is going to have medication or drugs in there. So is it horrible to have medications and drugs in there? No. You know, the reality is when you talk about antibiotics and you talk about certain pain relievers and you talk about certain medications, I mean, they're life changing. They've saved people's lives and still do by the millions. So the idea that you hear some people, they take one stance and try to do everything all naturally and all drugs are bad and they're all horrible, and that's an irresponsible, I think, position to take when it comes to medication and medicine and the treatment of certain sicknesses and diseases. On the other hand, often many of us get into a place of sickness, disease, and need treatment because we didn't take care of ourselves, right? So we'll need the life-saving surgery or we'll need the life-saving drug, not because of a trauma of a car accident, but because we weren't tending after our body as we should have for many years, and as a result the body gets into a severe crisis and is in need of emergency attention, is in need of something that's critical. Hey Wendy, good morning. Needs something, a critical attention in order to save it. So here's the challenge with any and all medications, that when you take a pill, let's say you got a headache. Let's just take that. That's a common reason for somebody to take a pill, right? So let's say you got a headache and you take aspirin, you take a Motrin, take a Tylenol, whatever. It's something we know but we don't think about. When you swallow that down, where does it go? It goes in your stomach, and then it dissolves, and then it goes into your whole body. So it doesn't just go to your head, right? So the pill doesn't just go to your head. It goes to your lung, your liver, your kidney, your knee, your toe, your pinky, your eye, right? It goes to all parts of the body. It goes throughout the whole body. So the question we need to ask is, number one, what's it doing there, right? What's it doing there? And number two, another question is, do I have headaches because I'm deficient in Motrin or Advil or Tylenol, right? No, I don't. I don't have that problem because I'm deficient in that, right? And we need to look at symptoms a little bit more responsibly and go, why do I have the symptom? Do I have a symptom because there's something wrong? Do I have a symptom because I injured myself? Do I have a symptom because my body's trying to tell me something's wrong? And if it's an intelligent response by the body, like a light on your dashboard to tell you your car's overheating or you're out of gas, right? Or a fire alarm in your house, smoke detector, if you will, telling you something's wrong, and I just suppress it all the time with pills and never addressing the underlying cause of the problem, typically the problem gets a lot worse. And some of us have experienced that. Maybe you're somebody that has a problem out there and you're like, hey, I take a couple Advil every day, and now it's, or every week, now it's every day, now it's twice a day, now I have to take that along with 3 other pills in order to handle my blood pressure, right? It used to be 1 pill, now I'm taking 3 pills to handle my blood pressure, 3 different medications. Or I'm taking 3 pills to handle my atrial fib. Or I'm taking 3 pills because I've got digestive trouble. And all of a sudden, I start taking all this stuff. And then the reality of that is the longer I take it, the likelihood of me developing side effects to the drug, because the drug just doesn't go to where you are taking it for, right? The reason of having high blood pressure, they're usually angiotensin reuptake inhibitors that go to the kidney that affect angiotensin, which affects permeability the blood vessels and areas in the kidney. And now all of a sudden, that drug's going everywhere. So it's starting to do bad things to other areas of the body as it's trying to regulate my blood pressure, right? And then I'm taking another pill and another pill. And all of a sudden, I start to realize, and I know this sounds crazy, that one of the number one reasons that people die in the United States, it's not a coronavirus, it's not car accidents, it's not heart attacks, it's not strokes, it's not cancer. It's actually side effects of medication. So the problem you run into when you say that is then you have people say immediately, well, geez, I would have died without it. Exactly. So it's not that all drugs and surgery and things are bad. It's that we need to use them more responsibly, both as a medical healthcare provider, but also more importantly as the patient. We need to look at it and say, wait a minute, I don't feel good. I might need some drug short term to get myself out of crisis, but I got to look at this long term. I can't live on this pill all the time for the rest of my life, or a lot of medication on the rest of my life. I need to start making changes in how I take care of my body, right? So if this is a machine, right, which it is, it's an unbelievable machine. It's a gift from God that we've all been given for free. Got this awesome body and this awesome life, right? And then God gives you this body, and then you're treating it horribly, and it starts to fail us, and then we're pounding it with drugs, and we're replacing body parts all the time, and we're starting to do all these bad things to us. The quality of our life starts to suck, right? The fun and enjoyment of our life is awful. We're not going to live as long. It's certainly selfish, because then it affects all the family members that rely on us, and the quality of your existence just starts to really get poor. So the best way to handle that drug and over-the-counter and prescription drug situation, the bad and good on it, is whatever you're taking. Obviously, you always have to have conversation with your doctors, but you want to say to yourself, what can I do to make me better? Is it eating a little bit better? Is it taking, oh, Dr. Joe, I can't go to the gym. I could never do that. Could you take a walk? Can you get a stationary bike at the house? Could you use the stairs? Could you park a little further away when you pull in the parking lot so you get a little chance to walk a little bit further? What can you do? Little teeny weeny things that you can do to start to improve your overall health. As a chiropractor, I'm always focused on how your brain's ability to communicate to the rest of your body is. So I'm going to tell you, do you have a chiropractor? Who's your chiropractor? Who's looking after you? Who's taking care of you and your family? So you got to add a chiropractor. You got to add good nutrition. You got to add movement of whatever that can be. Some people deal with obesity. Some people deal with severe arthritic problems and such. I get that. But we certainly have to start looking at what each and all of those things are and start to make little changes. The easiest thing to do is to take 3 little things and work on those 3 things for a month. So you take 3 little things. I'm going to add, don't even take anything away. Maybe you're doing some things that aren't really that great. Add 1 little thing with nutrition. Add 1 little thing with your exercise. Add 1 little thing that's going to put your mind and body and your mental state, if you will, in a better place, right? And you add those 3 things and you practice that for a month, and then the next month you add a couple little things, and the next month you add a couple little things, and geez, 3, 4, 5, 6 months into this, you're like, wow, my life is dramatically improved by doing these 3 little things each and every month. It's amazing. It's unbelievable. And that's the joy that I have. So listen, I'm Dr. Joe Borio. I'm a chiropractor in Cicero. My life is dedicated to taking care of all of you. I'm right here in Central New York. If you're not in my office, if you're not a member of my office, if you're not seeing a chiropractor that's somebody that's taking care of you, give us a call today. You could hit the link right above. It's got my phone number on there, no problem. It's got our website, Borio Chiropractic. It's got the link. You can click it. It'll bring you right to our website. You can make an appointment on the website. You could text us from the website. You could call us, whatever. You can message me through Facebook. So whatever means of communication you want to use in order to get contact with our office. I've got the best staff in the world. We've got Floria, who's new. We're real excited. We got Lisa, we got Leanne, we got Paige, we got Heather. So we got a great team in here to take care of you. And to make you feel more comfortable, this is my office. So this is what we look like. This is what it is. You come in here, we take care of you, no mystery. We've got a beautiful place here to tend after you and your family and give you a better life. And essentially that's That's what we're here for. We're here so that your body is better, because I realize the healthier you are, the better your life is, and that's what I want. I want you to have a healthier, better life, you and your family. Okay, so love and appreciate you. Virtual hug coming out to all you guys, from me to you, and live your life today with some passion, have some fun, do something special for somebody else. It's always the best way to make yourself feel as good as possible, and I will talk to you tomorrow morning. Have a great day.